Welcome, and thank you for taking this training on Medicaid. After watching this video tutorial, you will be able to answer the following questions. What is Medicaid? Who is eligible for Medicaid? What does Medicaid help pay for? And how to apply. In the United States, people need health insurance to cover a percentage of costs for doctor and hospital visits. There are different types of health insurance programs. For example, there are private individual plans, which are accessed through work, or are employer-sponsored, marketplace health plans, set up by the Affordable Care Act, Medicaid, and others. Medicaid is a federal and state health insurance program for low-income families. Pregnant women, children, adults, and people with disabilities may qualify for this type of health coverage. Medicaid coverage may vary by state. Medicaid works like any other health insurance for health plans and provider networks. Medicaid is not a cash benefit program, but rather it sends payments directly to your healthcare providers. Some states may require you to pay a small portion of the cost for some medical services. Medicaid coverage may vary by state. Some states cover any person who meets certain income requirements, while other states have other requirements that an individual must meet to qualify. Anyone of any age who has limited income and resources may apply for Medicaid, including children and teenagers. If you are a child under the age of 18 living on your own, you may be allowed to apply for yourself, or any adult may apply for you. Some states may cover children up to the age of 21. You can apply if your child is sick enough to need nursing home care but can stay home with good quality care at home. Pregnant women. You can apply for Medicaid if you think you are pregnant. You may be eligible if you are married or single. If you are approved for Medicaid when your child is born, both will be covered. Aged, blind, and/or disabled. If you are age 65 or older, blind or disabled, have limited income and resources, are terminally ill in need of hospice services, or are living in nursing home care but can stay home with special community care services, then you may be eligible for Medicaid. Medicaid coverage is state-specific, so benefits can vary from state to state. However, every Medicaid plan covers hospital stays, doctor visits, laboratory and X-ray services, and family planning and pregnancy care. Some Medicaid plans also include prescription drug coverage, physical therapy, eyeglasses, chiropractic services, and dental services. If you qualify, you may also be eligible for up to 3 months of retroactive coverage for unpaid medical expenses if you were eligible for Medicaid. To find out how to apply for Medicaid in your state, visit www.medicaid.gov/about-us/beneficiary-resources/index.html #state menu. You must be a resident of the state where you are applying for benefits. You will be required to verify your identity, immigration status, and income to be determined eligible for Medicaid. The application can take 30 to 45 days to process. Once a decision has been made, you will receive a written notice in the mail. Enrollment for Medicaid is year-round. You can apply for Medicaid at any time. If you qualify, you may start getting benefits right away. If you do not qualify for Medicaid, you still have individual insurance options through the marketplace. The health insurance marketplace is a service that helps individuals and families to compare health insurance plans for coverage and affordability, enroll or change healthcare plans, and get answers to questions about health insurance. You may qualify for a special enrollment period if you lose your job within the previous 60 days. To find a plan that works best for you, visit www.healthcare.gov/glossary/health-insurance-marketplace-glossary. Visit refugeewelcome.org for more community sponsorship resources.